The cost of medical waste disposal. Managers in medical facilities face a common dilemma: how to dispose of their medical waste safely and properly. Government regulations on a state and federal level determine the way that you dispose of anything that is considered regulated medical waste. These requirements reduce the risks associated with certain waste materials during disposal, but they can be costly for your facility. By getting your medical waste disposal program in check now, you can put your facility in a position to quickly respond to regulatory changes while reducing operating expenses and risk. Use the following tips from TriHaz Solutions to optimize your policies and procedures. The true cost of medical waste disposal. The cost of medical waste disposal can vary significantly depending on the methods used and the regulatory requirements that need to be met. Traditional methods, such as incineration and chemical treatment, can be costly due to high energy requirements and the need for specialized handling and neutralization processes. On the other hand, autoclaving presents a cost-effective alternative, particularly because it utilizes steam and pressure, which are less resource-intensive compared to burning or chemical processing. Additionally, the reduced environmental impact of autoclaving can lead to fewer regulatory fines and compliance costs. However, the overall expense is also influenced by factors such as the volume of waste, transportation costs, and local disposal fees, making efficient waste management practices critical for controlling costs in healthcare waste disposal. How much does medical waste disposal cost? Medical waste disposal costs can range widely depending on your facility type, volume of waste, and service needs. Typical pricing ranges from $50 to $500 plus per month. Facility type, typical monthly cost range. Small medical or dental office, $50, $150. Chiropractic or outpatient clinic, $75, $250. Veterinary clinic, $100, $300. Multi-provider medical practice, $250, $600. Plus, hospital or surgical center custom quote required. Hidden medical waste disposal costs. Fines. Non-compliance with disposal regulations can result in serious consequences. Agency potential penalties. OSHA, up to $15,625 per violation. EPA, RCRA civil and criminal penalties. Fines for improper transportation or labeling. State health agencies revoked operating licenses, site shutdowns. Medical waste container costs. Proper container usage can also reduce your disposal fees. Ask your provider about right-sizing containers to avoid overfilling or underutilization. Locked access for sharps containers. Color-coded bins for waste stream separation. What factors affect the cost of medical waste disposal? Several variables impact your monthly disposal fees. Waste type. Sharps, pharmaceutical, chemo, or infectious waste. Each require different handling, treatment. Volume of waste. Higher volume equals more containers equals more cost. Pickup frequency. Weekly pickups cost more than monthly or quarterly. Container type and size. 2-gallon sharps containers versus 30-gallon regulated medical waste bins. Location: distance from treatment facility affects transportation fees. Compliance requirements: documentation, manifests, and regulatory paperwork affect pricing. Bundled services: training plus disposal services can offer discounts and avoid fines. Medical waste disposal cost by waste type. Not all waste is treated equally or priced equally. Waste type relative cost notes. Sharps waste, low, moderate, most common, easy to manage. Regulated medical waste, RMW, moderate. Includes soiled PPE, bandages, pharmaceutical waste, moderate. High includes expired or unused meds. Chemotherapy waste, high, requires specialized handling. Pathological waste, high, includes tissue, organs. Hazardous waste, RCRA, highest, must follow EPA treatment protocols. Cost per pound versus monthly plans. Many providers advertise per pound pricing, but in practice, most facilities are billed using monthly service plans that include pickup and transportation, waste treatment and destruction, compliance documentation, container rental or supply. OSHA, HIPAA, DOT regulatory coverage. Example, a 10-provider clinic generating to £30 month may pay $150, $300 month depending on service level. Avoid choosing providers who quote only per pound costs. Ask about bundled compliance plus pickup plans. Mail-back programs versus scheduled pickup. Mail-back, low upfront, higher per box, best for solo providers, ultra-low volume. Pickup services, more cost-efficient over time, best for clinics, labs, multi-provider offices. Mail-back kits may seem cheaper at first, but they can add up quickly and often lack full regulatory coverage. TriHaz offers both options, and we'll help you choose what's best based on volume and risk. Key takeaways: how to reduce your medical waste disposal costs. Right-size your service based on volume. Consolidate pickups if possible. Bundle compliance training to avoid fines. Use the right containers to reduce overages. Choose a provider that knows your regional, state regulations. Avoid too good to be true. Pricing non-compliance costs more. FAQs. Medical waste disposal cost. Q. How much does medical waste disposal cost for a small clinic? A. Usually between $50 to $200 month depending on waste type and pickup frequency. Q. Is per pound pricing common? A. Most facilities use flat rate plans that factor in weight, type and service needs. Q. Is mail-back cheaper than pickup? A. For very low volume generators, yes, but pickup is more scalable and compliant for most. Q. Can I bundle OSHA training and disposal services? A. Absolutely. TriHaz offers discounted training plus pickup plans for qualified clinics. Q. What happens if we violate disposal rules? A. You risk fines, citations or shutdowns. We ensure that never happens. Need a custom quote? We've got you covered. Whether you're a new facility or reviewing your current service, We're happy to help you find the most cost-effective, compliant plan possible. Give us a call at 256-464-2546 for a free quote.